Yes, thank you very much. My name is Mike. Today I want to share with you a very important topic, and that is urinary tract infections. And most popularly known as UTI, but these are urinary tract infection. Now, urinary tract infection is any infection along the urinary system. It can either be urethra, bladder, ureter, or kidney. So any infection along those organs, those are what? Urinary tract infection. Now, when it affects urethra, it's called urethritis. When it is along within the bladder, it's called cystitis. When it's within the urethra, it's called urethritis. When it's in the kidney, it's called pyelonephritis. So these are the different infections that we always get when you have UTI. Now, causes: normal urine, it's purely water, salt, and waste products of metabolism. Now, when you get anything other than that, that becomes a problem. Should you get any infection, or should you get any microorganism which is outside what I've just mentioned, that's the beginning of the problem. Now, most bacteria, or most common cause of infection, is called bacteria, and this bacteria is called Escherichia coli, or commonly known as E. coli. And E. coli is is a normal flora when in the digestive system, especially along the colon. In the colon, E. coli is a normal flora and doesn't cause any infection within the what? Within the colon. And also along the what? Along the anus, along the anal area. Anus is a condition of what? Of the colon. So even around the anus, there's no problem. It doesn't cause any infection. But should you get any dislocation from that point of anus to the private part of the woman, that's the beginning of the problem. That's when you get the problem with the what? With this condition I'm talking about. So when these bacteria get access into the urinary system, it starts multiplying and causing the symptoms of infection. That's why most people, you can, from nowhere, you get your doctor may say you have UTI, urinary tract infection, when necessarily you have not met any man. So do you think you can get it even without meeting any man? So that's ideally what happens. And it has caused many chaos in the family. You get a woman is blaming the husband is blaming the wife. What has really gone wrong? But this purely just to give you understanding of what the infection is all about. Now, some people may ask, what are the symptoms? How will I know I have UTI? First of all, UTI, it is caused, most cases it's acutely or abruptly. It always happens abruptly. Some that happen some that not used to happen, it happens abruptly. Now, it is present with urinating all the time. You feel like having the feeling of puking all the time. You get burning pain when you're urinating. You also feel pain in lower abdomen. Sometimes the urine is cloudy or whitish like that, or sometimes even blood. You feel like you're tired. Sometimes you feel like the urine smells bad. When you urinate, you feel like the smell of the urine is bad. Basically, those are the few symptoms or signs that you can usually take as a key to diagnose your UTI. Now we go to diagnosis. How do we diagnose someone with UTI? We do urinalysis, where you pick the urine and we test in the laboratory. We can also do culture sensitivity, where we pick your urine, we take to the laboratory, we give necessary conditions, and we locate the exact bacteria causing that, and also give the medicine which is right for that particular infections. And thirdly, we can also do the scan, ultrasound scan, to check the organs, the kidneys, the bladder, and other things. There are also other tests which are not very necessary for now. Now, someone may ask, how do you prevent this infection? Prevention is better than cure. This is what I always tell people. Prevention is better than cure. And most important, the reason why we do this video, to prevent. We want you to be well informed so that you know what to do. We always advise people to take a lot of water. Taking water helps you to re-get your bladder so that you urinate all the time and you get out of bacteria when you have gotten infection. Secondly, you urinate when you feel like urinating. Don't Don't take a lot of time to urinate. When you know you feel like urinating, go and do it. Thirdly, take shower each and every time. Let's say if you are going to meet your man, or your man is going to meet a woman, before and after sex, always bathe or clean yourself. And also, it's advisable to urinate after sex, because that urination will help you to flush out the bacteria which might have gotten stuck there. Now, the most important thing that people don't understand, most females, when they are cleaning themselves, they clean themselves from back to front, which is not right. At this point. When you clean yourself, you clean from front to back. Reason being, when you clean from back to front, you will be getting those bacteria from your anus to the private part, which is not okay. We advise you to clean from front to back, so that you don't get whatever is the behind remain behind there. So that's ideally the logic behind cleaning from front to back. Also, women who put on tight clothes, this is not good, because you give unnecessary condition with alba, or give bacteria or condition to grow. And also advisable to women to put on cotton and loose fitting clothes, so that cotton absorb moisture or water. But when you put on these other nylon kind of dresses, it just harbor, or it keeps the fluids in your body, and by the time you get a lot of moisture around your body parts. Now, this especially goes to people who put on, I hear people say that kind of dress is called bikers, or these tight clothes, which is not good. I'm not saying you don't put it, but these are the medical purposes. For medical purposes, you can take it as a very serious and necessary information. So barely, I want to stop there. But also, if you want to treat, you can treat with your medical expert by either giving you antibiotics, also giving you other necessary information. So thank you for sharing your time and taking your time to listen to me. I really thank you. In case you have another comment, you can post on the comment section, and also like the video. Thank you. May God bless you all. Amen.